On today's Two on Your Side Town Hall at 5:30, a full reopening. No capacity limits, no restrictions, and just a couple of months away. The mayor of New York City says that's possible. So what about here? We're going to talk about that with an infectious disease expert, and we'll also ask the doctor about plans to safely have the Buffalo Marathon this summer despite COVID continuing. And stop and go. Unsynced traffic lights frustrate all of us. Some of us more than others. We've reported on this extensively. We're going to be asking the city of Buffalo about the plan moving forward to try to make for a smoother commute. And we thank you for joining us for our town hall today. I'm Michael Wooten. Kate is off. We are going to begin our rundown here with a conversation about the continued reopening of New York State, even as the COVID-19 pandemic continues. So there was a bit of a surprise announcement that came downstate earlier today, and we're wondering how it could affect Western New York. Mayor Bill de Blasio of New York City said on MSNBC's Morning Joe program that the Big Apple will fully reopen in just a couple of months in July. He cited the vaccine rollout and also declining hospitalization rates. Of course, the state will have the final say on this, but here's how de Blasio put it.
Our plan is to fully reopen New York City on July 1st. We are ready for stores to open, for businesses to open, offices, theaters, full strength. Because look, what we're seeing is people have gotten vaccinated in extraordinary numbers, 6.3 million vaccinations in New York City to date. We know the vaccination effort is going to grow and grow. We got to keep working hard at that. But what's amazing is every single day we're beating back COVID more and more. Hospitalizations down. You know, we're just seeing a better situation every day. We're ready to take that pathway to a full reopening.
That pathway to a full reopening. We want to ask Dr. John Sellick about that and what it maybe means for our region. He joins us now. Dr. Sellick is a hospital epidemiologist with Kaleida and an infectious disease specialist. Dr. Sellick, it's great to have you back on. Thanks for your time.
Michael, thank you for having me again.
So we just heard there the mayor down in New York City saying he thinks things are going well enough right now. I mean, it's hard to predict into the future, right? But he's saying in a couple months' time, he thinks we're going to be at this point, or at least they will be in New York City, where they can do this full reopening. I want to just get your reaction to that, and what do you think people here in Western New York should take away from that?
Yeah, it's very interesting. You know, you hear someone say that we're going to have 100% full reopening. I'm not exactly what they mean by that 100% full reopening, but I think that we've been talking about this for a while, that this was going to be a gradual process, that as we get more people vaccinated and the cases keep going down and the weather gets better and we can get outside, that we're going to be able to do more as time goes on. And I think the little CDC graphic that they put out on Monday when they updated the mask use guideline, if you look down the right-hand side of that with the the little green vaccinated guy, that the more people we get vaccinated, the more we're going to be able to do, whether it's in New York City or in Buffalo. So we have to keep our eye on that ball and continue to get our vaccination numbers going up. And again, that in combination with the good weather should allow us to be able to do a lot more outside, and with more vaccination, even more inside as well.
Yeah, it's interesting. We talked earlier this week about what's happening in Israel, and I mean, their vaccination rollout has been so successful that they went an entire day with not a single death in the entire country from COVID. I mean, you can really see cases just plummeting, and it's because they've hit that point. The difficulty here, though, really is projecting into the future, right? I mean, the vaccine rollout has gone really well, but as a country and also as a region and as a state, we're not doing as many vaccinations per day right now as we were just weeks ago because, you know, there's more demand or there's more supply now, but it seems like less demand. I should point out the governor said earlier today that he would love to do the full reopening even earlier than July 1st, as New York City's mayor said. But I wonder what you think if we don't keep up with the vaccinations and we aren't able to hit that herd immunity mark. I mean, it's going to be difficult to do this in the summer, don't you think?
Yeah, it's going to be a big challenge, and we're all a little bit, I'm not going to say we're worried, but, we all have some concerns that things have slowed down a little bit. And certainly early on, we saw people, pushing one another out of the way to get ahead online to get a shot. And now, as you point out, we have good capacity and we're not seeing quite as many people get in. we don't know what that magic number is that we have to get to, mainly because there is no magic number, but it's certainly more than the 45% any shot, and about a third are completely vaccinated in Western New York. We're going to have to do better than that if we want to get to that point. And again, I think the main reason for people to get vaccinated is because it protects you, it protects your family, it protects others who are at risk. But also it's going to give us our route out of this. The more people get vaccinated, the more we're going to see these restrictions loosen. And you're right, it would be great if huge numbers of people got vaccinated and we saw those numbers of cases go to ground like they have headed towards in places like Israel. Then it would give us that opportunity to maybe it's not going to be July, maybe it could be June. If we really, get our wheels going on this.
Yeah, I want to pivot for just a second and talk about one of the big summer events that so many people look forward to that actually got the go-ahead today from the governor, talking about the Buffalo Marathon. It's going to be happening June 26th and 27th. We spoke to the race director shortly after that announcement earlier today. Listen to this.
The state has our plan, and one of the things we talked about is the marathon would be a prototype for other races around the state. We are certainly the largest event coming back. I was one of the first races to postpone last year at the start of COVID, and it's nice to be one of the first races back in the state.
All right, so Dr. Sellick, of course, they're excited to be able to do this. The race will be reduced to 50% capacity. Still a lot of people, though. What sort of planning and safety measures would you advise for an event like this? We know that it's outdoors, people are moving, you've got good circulation, but there can also be times, with a race where people are in pretty close proximity.
Yeah, I think that's when I first heard this morning, that would be my big concern, that for years we've watched, people get set up for, marathons and 5Ks and 10Ks, and you have all these people jammed in close together at the starting point, and you say, wow, it's, even though it's outdoors, this still creates some hazard because of the number of people who are so close together. So I think restricting the number of people who can participate, and anything that they could do to prevent that all, everybody jammed together there at the start, to spread that out as much as possible would be good. Perhaps most likely with mask wearing before the race starts. Obviously, elite athletes like this aren't going to be wearing masks while they're, running 26 miles. But I think that we still have to keep in mind that we're not down to that minimal number of cases, and we don't have that level of immunization yet, that it's going to be safe to just bring thousands of people very close together. So I presume we're going to see a lot more about this. Again, they've moved it a month later than it usually is. So we have just about 2 months to plan for this. And that's going to give an idea to see how much better we do with vaccination, and how much better we can do with planning. And again, just like I recommend for everyone, I think anyone who's planning to run in that race should get vaccinated before the race.
Yeah, no doubt. Hopefully you can still get the celebratory beer at the end of the finish line to celebrate doing a marathon.
It would be a great start, wouldn't it?
Yeah. Finally, Dr. Sellick, I want to ask you, and we're going to put this on our screen so our viewers can see it. We obviously follow very closely the state's vaccine tracker. It shows right now that we are over 45% of the population in the state now getting at least one dose of the vaccine. But this is kind of color coded, and the green counties, including Erie County, are in that above average category, doing better than the rest of the state. Those that are colored in blue are right around the state average. But the vast majority of counties in the state, and all of our other counties besides Erie County, are below average. I feel like we're at this point right now in this process where it's easy enough to get a vaccine that this really illustrates where people are choosing to get the vaccine as opposed to where people have access to get the vaccine. So what do you think the strategy should be now as we look at all these areas of New York State that are not doing as well as, say, Erie County? What is the strategy to get shots into arms for these people?
It's a real challenge, because in the urban areas, we have lots of opportunities. We have many different ways that we can do this. There are still challenges even in the urban areas. You have people who are homeless, people who are homebound, people who are incarcerated, et cetera. Those are all tough groups. I think it gets a little bit harder as you get more rural, as you get outside of the urban areas. Certainly getting the vaccine to the large pharmacy chains and such is a big help because they tend to be spread all over. So that's good. Many health departments, you're seeing more of these pop-up clinics. I know the VA has been doing these pop-up clinics where they're saying, okay, we're going to go to Jamestown and have a clinic on Saturday for flu shots. And by the way, this is one of the great places for the Johnson & Johnson vaccine because it's a single dose. I'm always a little bit fearful as you get out into the rural areas that, the political considerations get a little bit greater and there might be more resistance to getting vaccinated there, which is unfortunate. And I think we just have to keep working on that core theme that this protects you, it protects everyone around you, and it's going to help us get to the point that we want to get to so that our lives are not being run by, this very small virus.
Yeah, and it's safe and effective. It's great to chat with you about it. Dr. John Sellick is an epidemiologist, infectious disease expert. Thank you so much for coming back on the show.
Sure. Michael, thank you again for having me. Be safe.
Have a good one.